We'll get started in 3 minutes now. So we've got about 1.5 minutes. Everyone will please mute themselves. All right, good afternoon. It's 3 o'clock, so we'll go ahead and get started. Thank you to everyone who's joined us. And again, and I'll say this a couple of times as we go through, you'll just make sure you record your name and organization in the chat box. That way we won't miss anybody on attendance. We've got a really interesting meeting today. We actually changed the meeting format about 10 minutes before the meeting because we were contacted about some legislation that is being proposed in the Georgia House of Representatives for consideration, and we were asked to gather some information and input from members of our continuum of care. Of course, it's a very quick turnaround of information, of feedback time. So we'll go over that in just a little bit, but I wanted to express how excited we are that everybody's here today. We've got a good crowd. We've got some interesting items to go over. Some statistics on what we've been over doing the last couple of weeks, also what our system looks like over the past year, and how we hope to collectively move into the future in our continuum of care. And let's see if I can go ahead and get my slides. All right, we're going to talk about system performance measures. And as I said, the legislation that's being proposed to be presented to the Georgia House of Representatives for consideration, which is the Reducing Street Homelessness Act. The Parker Challenge, which I'll explain in a little bit. Some very, very raw data from our point in time count, which was done 2 weeks ago today. Any updates from any of our wonderful agencies across our community that need to express any changes, updates, interesting information, events coming up, announcements, those kinds of things. And as always, we will send out the slides, any links, any forms referenced, any guidance reference will also be attached either to the presentation or to the email that the presentation is sent to you in. So make sure everybody gets all of the information. System performance measures is one of those things that causes angst in pulling them and making sure that they're being submitted as part of our HUD, our federal reporting requirements, to see how our system is performing against ourselves. This is the 4th year that system performance measures have been done. It's a way to look. Everyone can please mute themselves. If it's a way to measure what our system's doing, how it is performing based on our improvement from our numbers from last year and years previous, but also measuring it how we measure up across with other continuums of care across the country. And these kinds of things are taken in consideration when we are applying for federal funds from the Department of Housing and Urban Development, whether they be from the COC NOFA process, but also what allocations come to our communities through the ESG as well. You know, as I said, it's how we respond, how we are as a community, how our continuum is responding to the needs of the homeless in our community. And it's, you know, we're all about eradicating homelessness. That's what all of us are in this, you know, we're all in our jobs to put ourselves out of a job. Not that there will ever be a time where there won't be homelessness, but the way we do it should change dramatically. And if we're not changing what we do and how we do it dramatically every couple of years, then we're going backwards. But having a coordinated effort to meet the needs of the individuals in our community. And the measure, there's 7 measures. Actually, there are 7 measures in system performance measures. Prevention being one of them. That's measure 6. That's not, they're not quite ready. You know, it's not quite ready for prime time kind of thing. We haven't, as a nation, we haven't progressed far enough into that to start measuring that. But they reserved a spot in there for it. So right now we're measuring 6 measures. The first one being the length of time homeless. And so many times we think of our interactions, meaning our program or our organization's interactions with an individual experiencing homelessness. But these measures are system-wide. When this person entered the system of homeless service providers and when they were housed. So we need to make special attention that we understand that though Pat's rapid rehousing program may have enrolled this person today, knowing that I can house them within a short period of time. That's not their length of time homeless. That's their length of time enrolled in my program. So length of time homeless is a system-wide, community-wide number. And it takes the average and the median length. And it talks about emergency shelter, transitional shelters. Those are the numbers that are measured right now. There is talk that in the next couple of years, it will not only be measuring those in emergency shelter and in transitional, but those receiving homeless services and or coordinated entry who have a location of place not meant for human habitation. So again, very important that we get in the mindset of making sure that everybody we have is engaged in accessing housing, not just services, but accessing housing. And again, it talks about the first time they were identified as homeless until they were housed. And again, I think I've already covered this. Talks about, participation of all of us in making a better solution and changing the way we do things if we need to meet the needs of the clients. Don't have high barriers, meaning have so many hoops that a client has to jump through just to qualify for your program that that by the time the client qualifies for your program, they're darn near on their way to housed already. Well, if that's the case, then perhaps our programs are a little bit too stringent or have too many barriers, too many hoops that the client needs to run to jump through. Making sure that we meet the needs of the clients where they are and not necessarily requiring that the clients meet the program needs. The next one is the return to homelessness, measuring 6, 12, and 24 months after someone is housed. Again, what are the problems? What hinders successful retention of housing? What are the common denominators? And we actually will be, we've enlisted a technical advisor to start drilling into some of our system performance measures to see what the common denominators are of those who return to homelessness in that 6, 12, and 24-month period, to see how we can resolve and what we can do as a community to mitigate those returns to homelessness. Then, of course, talking about point in time count that we did 2 weeks ago, that's one of the things that we use in measuring the number of those experiencing homelessness in our community. The other way is looking at how many individuals were served in our HMIS system, our homeless management information system, by housing providers. This is not homeless services. These are housing providers, because we know that a lot of our services are provided. I say a lot. We have individuals and or families experiencing who are at risk of homelessness or who are helping prevent their homelessness by receiving services or agencies. Those are not included in the total numbers. And again, looking to see, are our overall numbers going down? This is the one time in anything any of us do that we don't want our numbers to go up. We want our numbers to go down. We want the total number that are experiencing homelessness on the night of the point in time count. Of course, we want it to go down. We're looking at a possible increase of a little bit this year. It is what it is. The data speaks for itself. But also looking at the numbers of those served this year compared to last year, what does that look like? Actually looks like it's a little bit down. And I say this year, meaning this past federal fiscal year, which ended September 30th. So it looks like that number is actually a little bit down. So that's exciting to hear. Employment and income growth, really, really important. I mean, all of us know if you don't increase your income, all of us, any of us, anyone who's trying to, take care of themselves and or a family knows, in order to enhance your quality of life, you must continue to grow. You must continue to progress. And our clients are no different. So having and increasing employment and income is paramountly important. These measures are only measured for permanent housing types of programs, again, permanent supportive housing, rapid rehousing, and transitional housing projects. Just a word of caution, every time that we make a requirement that a client meet an income guideline or whatever. Now, obviously, we have our income limits to enter our program. We're actually being counterproductive to our own performance measures that we're being measured on, because it is truly our job to make sure that folks get access to income, have access to services and programs to increase their income and enhance their quality of life. Also, talking about that same thing, it's important that we as providers, when our clients do get a job, when our clients do get other benefits, our clients do get their SNAP benefits or their TANF benefits, or start receiving their Social Security, disability, whatever, that we note that as a financial assessment in our HMIS system, so that those things can be tracked, because that's a huge part of what this is, making sure that we notate and document all of that. And again, it's to measure successes and where we can improve in our continuum of care, any of our programs across the board, and how do we compare other continuums across the country. The other thing that's measured in system performance measures is the first time homeless. How many people are entering our system now for the first time? And I don't know how many of you that are on this call now were on the call yesterday with Community Reinvestment, talking about the Georgia Rental Assistance Program that is being rolled out by the Department of Community Affairs. That is a perfect example of meeting the needs of prevention to mitigate the number of those first-time homeless. So it sounds like our community is looking at it from a proactive standpoint. We've been known to do that for quite some time. So exciting to hear that. But that's what this is measuring, is those who are entering our system for the first time. And then more importantly, as we drill down in that, why? What are the things that are causing folks to become homeless, and how do we mitigate those going forward? Again, one of the reasons we're having some data experts to do some drilling down into why and the hows of our system performance measures. And the last one is the successful placement of street outreach, or from street outreach, I should say, or in retention of permanent housing. And again, how many of those who are in our street outreach have been contacted by street outreach programs move into permanent housing, sometimes having to do a temporary stay at a shelter or whatever along the way, but ultimately end up in permanent housing. And again, the goal of getting people from the street into permanent housing, whatever that map looks like, whatever the roads are that you have to go down, but making sure that that is the ultimate goal for making sure that folks who are on the street get off the street and into permanent housing. Before, okay, one last thing, I'm sorry. We did submit our system performance measures prior to the deadline, which was yesterday. So we have successfully submitted, and our measures look better, tad bit, but better than they did the year before. So we're interested to see what that looks like, and what it looks like when we start looking at through the lens of the data analysts from our technical advisor. I'm gonna stop for just a second, just in case anybody had any questions. I think Denise was gonna monitor the chat. No questions? Okay, I will.
Yeah, there's a couple questions in the chat, Pat, in regards to clarity on length of homelessness. It says homelessness starts for someone based on what is recorded in a services only project, or does it start from emergency shelter and transition shelter? So I guess they're asking for clarification on when it starts.
Okay, clarity only. Okay, I'm reading it now. My understanding is when, and I will clarify this for you. In fact, we can pull up the data dictionary and we'll send it out, a clarification of this question. I think I know the answer, but my understanding is yeah, my understanding is it's only when they enter a coordinated entry, I'm sorry, not coordinated entry, I'm sorry, emergency shelter outreach or transitional, because services only again is not pulled in at this time, because many of those are but I will get double check that for you. Where can we view these system-wide measurements? In fact, Kim, that's a good point. Thank you for that. We will go ahead and I will get those in the weekly announcements for this Friday. I'll get those out. So thank you. Any other questions before we go? Cool. All right. And in fact, Kim, I'm gonna go ahead and step out on a limb. Kim and I actually, I owe Kim some data on one of her programs. She asked me to do some digging into some things. And actually, when I promised, yeah, we can get that together, when I got to looking, there was a lot more digging to get the answers that we needed, but it brings up some interesting some interesting questions and thought processes on how often do we look at what we're doing in our individual projects, in our individual organizations, and as a community wide, to are we meeting the needs? And if we're not, who do we need to be focused on? In fact, Kim, I almost texted you about 9 o'clock last night because I was doing some more digging, and it was really interesting, some of the numbers and some of the things that are being seen. So don't be afraid of let's do some digging into all of our programs and see how we can improve. I'm going to go ahead and resume sharing here real quick, because this gets into the meat of what we wanted to discuss, because literally it was 5 minutes to 1, and I got an email from Representative Calvin Smyrie from the Georgia House of Representatives asking for our Continuum of Care's input on some pending legislation, or some legislation that's about to be introduced, that he's been asked to look over and possibly co-sponsor. And it's the Reducing Street Homelessness Act of 2021. And this, I'm going to preface this conversation by saying, this is not to make homelessness illegal. This is actually a way to give providers throughout the state, this is of course a state bill, the leverage and the credit for doing the really, really hard work with the hardest to serve, rewarding those who do that, but also making things more uniform across the state. And I'm interested to see what everyone, so I'm going to pull up, nope. Really quickly, I'm going to pull up I can find it here. I need to pull up, I'm pulling up the legislation talking points, and then we'll actually pull up the actual bill that's going to be introduced. And it's talking about, okay, here we go. It's now there. Okay, so the talking points for the Reducing Street Homelessness Act. Let me see now. Get you guys back up here. And resume sharing. All right, someone just acknowledge that you're seeing this Word document that says Reducing Street Homelessness, please.
We can see it.
Gotcha. Okay. I'm going to let it sit here for a few minutes and let everyone read it over for 30 to 45 seconds, and then I'll go over some what I thought were the high points here, and I'll give it a few seconds and I'll scroll down, and then we'll look at the actual legislation, and then I really would like to have some conversation. And I know I saw that Adam from DCA is on here. Now, and Adam is our landlord engagement specialist, so he here may or may not be privy to some information on how this bill came together, or this proposed bill came together or not. But just to hear what our community has to say, because we have to provide feedback by 8 o'clock tomorrow morning. So if it's in writing and we need to have it by 5, or we're recording again the session so that we can transcribe any feedback we get. I'm going to go ahead and scroll down, and we will again supply this to everybody as soon as we get out of this meeting today. I'm going to come down just a little bit either. As we're going over this, as I said, the things that stand out are having some set asides for affordable shelter. Some of those will look and as we look at the actual legislation, you'll see some of those will be in the form actually of sanctioned, like campgrounds. Not to say where those are going to be in the state or whatever, but saying that there's an ability to fund those from the funds that DCA gets from the federal government, and that there will be programs, nonprofits, those who do implement these programs as homeless service providers can get bonuses for performance and for meeting the needs of the highest acuity or the highest need persons and families in our community. We'll scroll down just a little bit more. And the fact on the last paragraph here, talking about Houston, Houston, Texas has often been the gold standard for so many things in homeless homelessness response, coordinated entry, and many other things. And they used some state funds to supplement their outreach teams, and had they took and structured part of their police force into homeless response teams. I don't know that that's what would be functional here in Columbus. Honestly, we don't want to criminalize homelessness, but having an ongoing dialogue so that if someone is experiencing homelessness, the first call is to one of our outreach workers, is to one of the providers, is of course to 211 to access coordinated entry, from the aspect of the law enforcement who's encountering this person. So interested to see if there's anybody has any comments, concerns, ideas, anything else. I'm gonna stop sharing for a minute before we start looking at the actual legislation, because the legislation is like 12 pages long. Now, I know this is not a quiet group. I know lots of my has gone from housing first programs to rapid rehousing. Is there a way to redirect this funds? Okay, I don't know that I understand your question, Elizabeth, because housing first programs, housing first is a concept that you house and then deal with the other reasons that the person became homeless. Housing first can be used in any type of program, whether it be permanent, supportive, rapid rehousing, or whatever. And Liz is saying, with no new dollars, where would people go? Well, I think this is a redirection of the dollars is what I have read. In fact, we'll go into the legislation. But I think that's where we're being asked to give our input. I don't know. I know personally, and as an organization, we've never been asked what our thoughts were on legislation as it relates to homelessness. What dollars would get redirected? Well, in fact, any of the federal funds that come in, again, through to DCA, and in fact, maybe it's time I go ahead and pull up then the legislation as it reads, and I'm gonna pull it up, and then, as I said, oh, I'm sorry, it's 11 pages, not 12. I apologize, it's 11 pages. I'm gonna take you down to the page that actually deals with, and as many other bills, it's a lot of things in this bill. This talks about committing or doing involuntary commissions of folks with mental health and or drug issues, substance abuse issues. That doesn't apply to us, but here we go on section 7 here on page 6, talks about what a continuum of care is, talks about what a nonprofit is, of course, and talks about state funds, and that they'll be appropriated to the homeless service providers and all, based on what then is covered in the rest of this proposed legislation. It's talking about addressing homelessness and through continuums of care, nonprofits, short-term or long-term, and that, again, some of the things that they're proposing be available: safe parking areas, a sanctioned encampment, basically, with basic supplies, basic services for folks should that need to be, structured camping areas, again, sanctioned encampments type things, individual shelters that within those encampments or in other units for a short period of time. The interesting thing for me was that they were talking about, again, making sure that those who met, who have seen a decrease in homelessness and not an increase, that they have more flexibility, that those who have a higher level of per capita homelessness than others, they're being ordered on how to redirect their funds or how they can use their funds. And although it's talking about conducting a point in time count like information, but surveying jails and hospitals and this and that and the other. Ironically, again, 2 weeks ago when we did our point in time count, we had representatives of all of those institutions involved in the point in time count, participating, giving information, sharing of information, and in fact, receiving referrals on those days as well. So everybody working in tandem, talking about collecting the information in HMIS, involving sheriff's offices, which of course we have as well in our community, and making sure that we all are accountable. Monitoring the days unhoused or in shelter in the past year, asking about, excuse me, asking questions about if someone was incarcerated or whatever. Again, for those of us who use HMIS and who have done enrollments, I mean, this is part of our standard. This is not a big change for some of us, for a lot of us. But also those, the thing that I also like is here on lines 171 through 179, talking about those COCs and meaning the programs or projects, nonprofit organizations within the COC that assist those who have what they call the highest level of combined total days. Talking about those who are hardest to serve, breaking it down. I'm sorry. But that there will be a random selection from those who are the hardest to serve, and the agencies, organizations, nonprofits, whichever we want to define ourselves out, will be rewarded for serving those individuals. And also that this shall be a 3-year grant allocation instead of the every year having to reapply for the allocations of grants. And then it goes into some more details. Again, how you subcontract and those kinds of things. Talking about some things that are currently being used for permanent supported housing, and how what those allocations and allotments are for each of those costs, per bed, construction, those kinds of things, maintenance, and that. Also saying they're not going to give funds to areas who show an increase in unsheltered homelessness of 50 or more for 2 consecutive years, or that refuses to enforce the laws proposed here in the legislation. I do not have today on the slide a little bit later about point in time count, our unsheltered versus sheltered count for this point in time count. And the reason for that is, number one, it is a little anomalous this year because we were in the midst of a hard freeze. The night of point in time count, the low got down to 24, which meant we had 2 warming shelters open. So on the night of the count, we only have recorded or surveyed 18 people who reported as being unsheltered. We understand that had the warming shelters not been open, that many of the people who were in shelter the night of the count would not have been. So we've asked for clarification in writing from our HUD technical advisor on reporting that, because we know it's going to cause a flag in our reporting as it compares to next year, because it's going to show a dramatic drop. So rather than having to explain it at the end, we've already put in the submission to say we knew the data was going to be off when we knew the freeze was coming. We have our preliminary data, and it is way different than last year. But so that won't affect us per se. But I said all that to say, having an increase in unsheltered homelessness means that we are not meeting the needs of those most in need. That's not been a concern in our community over the past several years, because we've seen a steady decline in the unsheltered population. Are we going to always have it? Yes, we are. Can we manage it? Can we reduce it? Can we get it to a number that is
Not right now.
close to zero as possible? Absolutely. But yes. So, and again, talking about if also if a community has a per capita level of unsheltered that's greater than the state average, they have to also allot 25% of their grants to the community programs for criminal justice coordinating council. And again, talking about having a concerted effort to come to organizing a street outreach program and managing it. We do a decent job in Columbus. That can we do better? Of course we can. But we're not at a position, thankfully, where we're going to have many restrictions. But what I would like to hear is to have some conversation on if, you know, any of us could say, hey, take this out, put this in, we need this, we need that. We've been asked for our opinion. Now's the time to give our opinion. I'm going to stop sharing this real quick and let's have some conversation if we could. Okay, so Liz, you're saying you get requests or referrals for people with no income and are not looking for work and we cannot place them. What would be different? Who would we send them to? Well, I mean, in the perfect world, the idea would be to get someone connected with someone who can help them increase their income and or income, whether it be through employment, through other services or whatever. That would be the ultimate ultimate goal. Because again, we're going to have those individuals with no income, and yes, there are. We have to figure out how to meet the needs of the client, and it means, you know, combining efforts of 1, 2, 3, or however many organizations sometimes to meet those needs. Any other crystal ball kind of, can we add this? Can we suggest this? Please tell them to leave this out. And again, I know this is asking a lot to do in such a short period of time, but we were literally given this at 5 minutes. Okay, Michelle's asking, what would happen to someone who has had a bad experience in a shelter environment and reluctant to go back to this environment? Unfortunately, Michelle, this is not something that we haven't dealt with or haven't heard of before. And that's where it's our job as providers to come up with those other creative solutions. And right now, absolutely, I can send it now, Liz. I mean, it's sort of difficult to send it to everybody that's on the call right this moment, but I will send it just as soon as we finish talking. Yeah, absolutely. But yes, Michelle, we have non-congregate shelter funds available. Many of our providers have, for lack of a better term, hotel motel vouchers. There are creative ways to come up with it, a solution for the client. But, you know, the thing is not to always think of it. Someone has to go from the street to an emergency shelter, then to, you know, we can literally, hey, let's go ahead and get you enrolled now. Let's get you looking at apartments. Let's get you moved off the street and into a house. So yes, but there's creative ways to look at it. In fact, Terry, while we're talking, if you can go ahead and just email out to everybody that's on the navigation invite, that'd be great. Thank you. Any other comments, concerns? Anybody else have any dreams of things we can do, would like to do? Again, I'm compiling those this afternoon, tonight, in writing or whatever. We have to send it over first thing in the morning to the legislature for their consideration. I'm just excited that they asked us as a community, I should say, to have some input or to share our thoughts. And hang on, I'm gonna go back here and try and get started back on our presentation where we were. All right. So we talked about wanted to, for any of you who knew Mr. Parker, who was living on the direct optical porch, Mr. Parker passed away on Friday night at Columbus Hospice. And, you know, last month during our, during our navigation meeting, I issued sort of a coordinated entry challenge to ask everyone to make sure that when they're working with clients, when they're interacting with their clients, for whatever reason, to make sure that the client had an active enrollment in coordinated entry, and all that stuff. And if the client had an enrollment, were they working with someone? Mr. Parker had, back in last year, contacted coordinated entry, never showed up for an appointment. Got information a week before point in time count that there was a person living on this porch. Outreach team went and was told by someone, quote unquote, in the neighborhood. The ambulance came and got him. And ironically, we got a coordinated entry intake the day of point in time count that this gentleman was being discharged from the hospital, and he could not go back to the street. He'd been receiving services from a variety of providers for many, many years. So we're renaming the coordinated entry challenge the Parker Challenge. Let's make an investment in our programs by investing in those we serve. Constantly asking people where they're staying at each of our interactions. Contacting, you know, street outreach, contacting coordinated entry. Dave here at Home for Good, folks over at the PATH team. Kim, I see you on the screen, so I'm going to point at you, you know, and making sure that we've connected people. If you see someone you're not sure, whatever, you don't want to talk to, you're a little leery of doing that interaction, give someone on street outreach a call, and let's make sure that we make sure we've reached out and contacted folks that are living on the streets. Assist our clients with doing a 211 a coordinated entry form at entry. You know, making sure that whether you do it online at our online portal that's on the Home for Good website, that again we'll send a link to after today's call, in writing on the form that is also linked on that same place, that you can print out and fill out and fax in, or on the phone, whether it be calling 211 or if someone's using their prepaid phone, it's 706-405-4775. Making sure that they get those coordinated entry intakes, and they have access. And if you know, if you constantly seeing client and say, yeah, I have one, pick up the phone. Hey, what's going on with this person? Call some of it. Call. All of us need to call each other. Make sure that we're making contact with each other for our clients. You know, if you're in HMIS, you can look at the referrals in coordinator and see where the person was referred to. The clients in your office, you see that there's a referral to Pat's Rapid Rehousing, but you don't see an enrollment. Call Pat's Rapid Rehousing and say, hey, I have client ABC here who maybe you're trying to get in touch with. So making sure we follow up, we connect our clients, because all of us share our clients. You know, I would hesitate, there's less than 2% of the clients served in our area that aren't served by more than one agency. So it's all of our jobs to coordinate with each other and to coordinate with them. And then making sure we follow through and make sure that we're meeting the needs of the clients, and that we're not trying to get the clients just to meet the eligibility requirements of our programs. If we need to rework, we need to restructure, you know, it's hard, but let's look at doing that. I don't want any of us to have to deal with a situation again where, you know, someone dies alone. Thankfully, due to the efforts of the, you know, Nashada and getting him off the street and in a non-congregate shelter, and then having the wherewithal to know that he needed medical care that he could not get in a shelter. He did not die in pain, and he was safe and warm and dry. But let's make sure that we don't have this again. For those of you who've been around, it takes me back to when Mr. Garner died some 6, 7 years ago. He froze to death one night. So let's not let's make sure that we take the Parker challenge, and that we take heart, and that we literally can with everything that's available to our area, to our community, whether it be rapid rehousing, whether it be prevention that's coming down, whether it be non-congregate emergency shelter, we have the outreach that's available. We have the ability to cut the numbers of those homeless in our community as they stand right now in half, probably by the end of the summer, if we will all just, as they say, put the pedal to the metal and not be afraid to work that hard and to get it done. Point in time count, we've talked about many a times. Again, very, 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 very preliminary numbers. We have not gone through survey by survey and deduplicated by anything other than first name, last name, date of birth. So if all of those match, we did some rudimentary deduplication, but we have not gone through any further than that. Those are being done now, but we're not ready to finalize those numbers yet. But these are the preliminary numbers for this year's point in time count. Again, it was 2 weeks ago today. We saw an increase in male homelessness, a decrease in female homelessness, and a small decrease in children experiencing homelessness. So really, really excited about that. We've seen an overall decrease in homelessness, significant since the beginning of point in time count, but since 2016, we've had a 26% decrease. 16% decrease in overall, 26% decrease in males, and 1% decrease in females. The reason that 26 and 1 doesn't equal 25 or 27 is because we saw a significant increase in the number of children experiencing homelessness between 2016 and 2019. So we're excited that it's on the way down. And this is a perfect example of this data, after being published, was looked at by the folks at the Salvation Army who had a male shelter. And they said, wait a minute, the numbers of people we serve are going down. The numbers for the people we don't serve are going up. Perhaps we need to change our service model. And that's what they did, and became a shelter who focused on family. So again, very preliminary numbers, but even though it's up about 5 from last year, I think we need to consider it a good year, considering everything that our community's gone through in the past year. Any updates from anybody? Anybody got anything coming up? Need to tell us? Closures, promotions, anything going on that anybody wants to update anybody on today?
I got something, Pat. This is Dave from Home for Good. Hey, everybody. So in the chat, Liz is asking, call street outreach. What number do you want us to call? I'm putting my email address in the block there in the chat, so you can email me, and that way I can add the area of concern, or the person that you're wanting me to get in touch with. I can add that to our calendar and make sure that we're all on the same page and keeping track of all of that, keeping good records. So my email's in the chat.
Dave, I'm glad you brought that up, because that's a perfect way. Absolutely, is to do the email. And for those of you which is probably 95% of the folks who were on here, once you send that email over, do yourself a favor, go ahead and save it to your case notes. And that way there's a record of it and, everything is documented here or there. But yeah, that's great. Thank you for that, Dave. Thanks for that question there, Liz. Any other updates or concerns before we move on to a few other things? Okay, so to Donna. Hello, I'm tuning in from the Augusta Public Defender's Office. Our Sheriff's Office is having a meeting later this week on homelessness. I plan to talk about the work your city has done over the last 10 years. When folks on this call be available for questions or attend later meetings with our city officials, talk about how we get started. Sign us up. If you don't mind, Donna, if you'll put your email address in the chat box, we will send out your message as it is in the chat to everybody. Everybody that's on the call today and all of our other navigators in case they want to join in your meeting. Thank you, Don. I got that. Hey, Adam, you have put a link here to the rental assistance program. And you turned on your mic. So you go, Adam.
It's still not open yet, but we mentioned briefly, the information is public knowledge now that, of course, the governor has announced it. There's been a press release. It's been knowledge for a while. The actual application portal is not open yet, but on both of these websites, it goes over the eligibility requirements for the program. It goes over for both the landlord and the tenant. Landlords have to prove that they own it or that they're the authorized representative for the company. And have a rent register. Likewise, the tenant has to produce a lease that shows that they are supposed to be in that unit and just some other documentation. It's also for utilities, though rental assistance is the first priority. And I just wanted to have this out there first. And I got an email from marketing that says I can share these websites as a resource just so that people can go ahead and maybe start gathering this documentation, checking to see if they're eligible. And then I know there's conversations with your community reinvestment about about how that's going to work and different disbursements. But as far as I know right now, you all are still under our statewide umbrella. And so, we'll be the ones managing it. The temporary staff that we are hiring this is their first day of training. So they will be, hope to be operational, getting settled next week. So this program is getting off the ground, but I know it's been a slow rollout, but once it goes, it'll be going. So please, copy and save those links. I probably won't know the answers to your questions, but feel free to ask them or send them to me, and I will get to the folks that know. I just wanted to share this with everyone.
Thank you so much, Adam. I appreciate that. And again, we will forward the links in all of the emails that we send out to everyone. So again, having the opportunity to do rental assistance for folks who have been, so adversely affected by the effects of COVID-19 and the landlords who've been struggling is for those of us who've been having these discussions for a couple of months now about prevention. It's really a breath of fresh air that we can actually say we not only is it coming, it's pretty darn near here. So that's really exciting.
Yes. And it's pretty generous for a program. Now, of course, no one's guaranteed for the whole thing, but I mean, it can go up to 12 distance. I think there's a cap of 15,000. 8% of the assistance can go towards late fees and other administrative fees. So, I mean, it's as people get qualified, it is striving to be pretty generous. And of course, the funds expire at December 31st. So we're anxious to get them all spent and all our neighbors assisted as well.
Yes. And I'm glad you brought that up, Adam, because I think every call I've been on, every Friday HUD call I've been on for the past 2 months, there's been a plea to organizations who have CV funds to spend down your money. That there's a struggle right now because there's not enough reports of spend down that have happened versus funds that have been allocated. So, really important to say, don't be shy. If you think someone might qualify, send it to the experts and let them say yay or nay. Don't hesitate to see if someone qualifies for assistance. Thank you for bringing that up, Adam. In wrapping up, again, anything else, any other updates? Of course, we have our meeting again next month at 3 o'clock on the first Tuesday of the month, and I'm gonna have to cheat and look at the date real quick. That is April the 6th. But in the interest of making sure we get everybody this information and they can supply any input or whatever, I'm going to go ahead and wrap up this call. Again, if no one has anything else, any other, news they want to share or any other updates so that we can make, yes.
We did have a suggestion from Ken Allen that she'd like to connect with more job training opportunities for those who are homeless with no income. Just a suggestion.
Absolutely. Thank you for that, Kim. And I don't know if Mr. Challenger from Goodwill is on this call today, but actually, Kim probably need to have a discussion because he's going to actually start chairing our mainstream and outreach committee specifically for that reason. Mr. Challenger is a member of the COC board and works at Goodwill. So yes, absolutely. Hold on and get ready. Absolutely, making sure that everyone gets connected. Just an FYI right now, guys, I got an email just 2-3 days ago, I think it was. Every one of the Waffle House restaurants in Columbus and Phoenix City are hiring. Go online and apply, wafflehouse.com. They are hiring, and I think the starting salary, if I'm not mistaken, is a little over $10 an hour. So and of course that's for cooks and for non-wait staff. Wait staff, of course, I think is $2 and something plus tips. But so Waffle House is hiring. If you are anything like me, the Waffle House folks probably do pretty doggone good because they stay pretty busy. So let's make sure folks know that too. Anything else before we wrap this up? All right, again, Donna, we will make sure everybody gets your information to connect with you on your meeting, or to express an interest about meeting with you and or any of your local government officials or city folks about and the things that we've done here and how you may replicate them, or maybe some suggestions on how you guys have done things, and we might learn from them as well. Adam will share your slides and your links as well. I'm sorry, your links to your documents and to the information on the rental assistance. There's nothing else, guys. We'll call it a day. Y'all have a great one. Thanks.